So our final presenter for this session, but not for the afternoon, is Halikainen, and she is also earning her master's degree in public health. Whenever you're ready.
Okay, are you able to hear me in the back? Yay, wonderful. And I'll get started. I'd like to start by just mentioning that I'm really happy to be here today to talk to you a little bit about something that I find interesting, the intergenerational transmission of obesity risk. And I just wanted to say also that I'm so happy to be here in this beautiful Victoria weather because I came from Saskatoon where my first flight was delayed because of all the snow. So this is really, really great to be here. It gives me a little bit of a sense of energy to be here. And I just wanted to start from a place of appreciation. So I have many people that I want to thank here today from my practicum at the Saskatchewan Prevention Institute. And if you're not familiar with the Saskatchewan Prevention Institute, it's a provincial nonprofit organization which aims to improve health for children and reduce the occurrence of disabling conditions in children. And I had a wonderful experience there, and I'm happy to share some of it with you today. Okay, that worked, I'm glad. One particular outcome that I looked at in my project was childhood obesity. And as Karen touched on in her presentation, this is a major public health concern. Childhood obesity has been labeled a national crisis, and it's an issue that often makes front page news. Childhood obesity it's something that many solutions and many strategies have been proposed, and it seems to me as if most of those solutions and strategies focus on behavioral things, like increasing the amount of physical activity children get in schools and improving the food that they get in schools. All important, but I challenge you to think of something a little bit different with my presentation today based on the evidence. Should childhood obesity prevention start earlier in the life cycle and perhaps look at the prenatal stage? Okay, so I wanted to provide you with some context from my home province of Saskatchewan. We know that across the globe, obesity rates have been increasing over the decades, and Saskatchewan is no exception. We also know that a significant proportion of women in Canada are gaining more weight than recommended in their pregnancies. For example, according to most recent Statistics Canada data, about 44% of Canadian women gain more weight than the Institute of Medicine guidelines, which is concerning. We know that some subpopulations of Canada are at increased risk and possible vulnerabilities. We know that Aboriginal women might be, for example, at increased risk for maternal obesity and excessive gestational weight gain. One number that really surprised me was that Aboriginal women in Canada, 55% of them gained more weight than recommended in their pregnancies, and the reasons behind that are complex, but concerning. In Saskatchewan, we have a very high proportion of women who are of Aboriginal descent, so this makes this issue even more important. In Saskatchewan also, the prenatal services a woman will receive largely depend on where she lives. If she lives in an urban center like Saskatoon, she'll likely receive a whole comprehensive suite of packages of programs, very technical, very advanced stuff. Whereas in smaller rural centers and First Nations communities, they're struggling to even keep their community health nurses. So the services a woman receives largely depends on where she lives. In 2010, the Saskatchewan Prevention Institute conducted a fairly comprehensive literature review that looked at the health impacts associated with maternal obesity and excessive gestational weight gain. They looked at the impacts on mother and on the child, and found things such as increased risk of gestational diabetes, gestational hypertension, C-sections, birth injuries, and one in particular was hinted at in the review, possible increased risk for childhood obesity in children of mothers who were obese or gained excessive amounts of weight in pregnancy. More research was needed at the time, and more research was needed to clarify the potential mechanisms, and that's where my project came in. I wanted to add to this. I conducted a literature review and an environmental scan. All right, for my literature review, I tried to look at recent articles. I used Medline for my main search. I tried to answer 2 search questions. In women who are obese pre-pregnancy or gain excessive amounts of weight in their pregnancy, are their offspring at increased risk for obesity themselves? I also wanted to find out what are the potential mechanisms behind this. I didn't include studies that were about interventions, for example, interventions to reduce maternal obesity, because that's going to be the focus of an upcoming literature review by the Prevention Institute. However, I did try to include and seek out Aboriginal community-based research to make sure that their views were not excluded in my review. So I did a secondary search of an Indigenous database, the bibliography of Indigenous North Americans, to make sure that smaller journals such as Pimitiswin were included in my review, if possible. All right. My environmental scan was relatively small in scope, but was intended to give me a little bit of a better idea of current practice regarding promoting healthy pregnancy weights in Saskatchewan. So I consulted a group of community dietitians and consulted my contacts in the Canada Prenatal Nutrition Program, CPNP for short. And if you're not familiar with CPNP, it's a national program which is intended to improve nutritional status and health for high-risk women, including those living in poverty, new immigrants, etc. And I used email to consult the Community Dietitians Working Group in Saskatchewan and had a very lengthy phone conversation with my CPNP contact, the provincial liaison for the program. I wanted to better understand what strategies, what programs, what activities, what policies even are currently being undertaken by health practitioners across Saskatchewan, and to find out what resources have been developed in the province or resources that are currently being used. And I combined that with the web search to create an inventory of high-quality resources, such as handouts, videos, posters, etc., about healthy pregnancy weight gain, so that healthcare practitioners in Saskatchewan could have a list of these good resources available at their fingertips. All right, now for a brief discussion of my results. For the Maternal Obesity and Offspring Obesity Association component of my literature review, I screened initially 471 studies and found that 28 met my criteria for inclusion. Primarily looked at the association between maternal obesity and offspring obesity risk, and this association was, in most of the studies in the review, expressed as odds ratios. And I found that the association between maternal obesity and offspring obesity seems to be stronger in different offspring age groups, so that's how I will be presenting my results today. As we see, studies that looked at obesity in the early years, there was some evidence to suggest that maternal obesity increases this, but the evidence wasn't particularly strong. For example, one study found an odds ratio for childhood obesity of 1.09 if their mothers were obese pre-pregnancy compared to children of mothers who were not obese pre-pregnancy. So not much of an impact there. However, with school-age children, the odds of obesity were increased considerably if their mothers were obese themselves. And we found that as the mother's BMI increased, the child's BMI increased as well. In my literature review, studies that looked at this age group had odds ratios between 3.4 to 6.52. So I think that's a considerable impact. If we look at the teenage years, there's some evidence to suggest that maternal obesity increases risk for obesity in this age group. There weren't as many studies that looked at this age group. One study, for example, Rooney et al., found that children whose mothers were obese pre-pregnancy had increased risk for obesity in early adulthood, and their risk ratio, the relative risk was 6.35. And what about the potential mechanisms behind this? Well, we know that childhood obesity is a complex issue and that there's an interaction between the environment, between lifestyle, between genetics, and even the intrauterine environment. Dermis et al. Postulated that if the association between maternal weight status and childhood obesity is stronger than what you see between paternal weight status and childhood obesity, then it's likely that intrauterine effects are very important and should be paid attention to. Now looking at the effects of gestational weight gain, there were some studies that found this. I screened 77 studies and included 5 in my literature review. They found that, yes, there was an impact associated with excessive gestational weight gain on childhood obesity, and that the relative risk, for example, was around 1.7. Now for my environmental scan. 19 healthcare professionals participated in my environmental scan, which was great. Unfortunately, it seems like in the province there's very limited work being done in this area. For example, healthcare practitioners will sometimes discuss weight gain in pregnancy in prenatal classes. They might do an assessment of weight gain status in pregnancy. They might provide pregnant women with the weight gain recommendations. But that seems to be as far as it goes here in Saskatchewan, for the most part. Some programs are a little bit more intensive. Thank you. And those are probably ones that we could learn from. And generally, the resources being used in Saskatchewan come from the government, and they're not culturally specific. I think that my project had the potential to raise awareness about an important issue, but unfortunately, my environmental scan was fairly limited in scope in terms of the healthcare professionals who participated, and had some challenges with differing definitions in the literature review. So just wanted to wrap up here. There is evidence to suggest that excessive gestational weight gain and maternal obesity are important factors when it comes to the prevention of childhood obesity, but it's not often being recognized. We know that current practice in Saskatchewan is unfortunately limited, and that I would encourage the Saskatchewan government to consider expanding their proposed upcoming childhood obesity strategy to look at a prenatal component. Overall, there's a need for non-judgmental, culturally appropriate services to promote healthy weight gain in pregnancy. And these are my references. I've got a lot of them here. I'll go through them really quickly and give you an opportunity to ask any questions. Thank you very much. Thank you.
Any questions for Holly? Dr. Hay, have you a question?
I have a question for Holly,
Yes.
and then I have a comment.
Okay.
So my question is, one of the things that really struck me about what I thought was an excellent presentation was a link between the literature that you looked at and what's called the Barker hypothesis.
Oh,
I don't know if you've come across that or not.
Is that referring to the developmental origins of adult disease?
Yes,
Yes,
it is.
okay.
Yeah, and so it seems to me that there was something in that
Yes.
that just made that kind of connection to another conversation that we would have had in the past.
Yes.
That, you know, as you take your thoughts forward on this, if there's any more to do on this, you might want to consider
Yes.
the degree to which that might also be bound up in that hypothesis, which of course itself is quite controversial.
Right. Yes, thank you for that. I myself really want to learn more about the Barker hypothesis and for example, epigenetic programming and whatnot. I feel like there's so much more for me to learn, and I think that in my role as a healthcare professional, I'll definitely try to encourage more discussions among my peers about this important concept. Yeah.
Thank you.